Good morning, everyone. My name is Rob Kursick, and I'm the Communications and Member Engagement Manager at OMSSA. And on behalf of the association, I'd like to welcome everyone to today's webinar, an abbreviated history of social services in Ontario and OMSSA's role within it. I'd like to begin this morning with a land acknowledgement. The land on which OMSSA operates is the traditional territories of the Mississaugas of the Credit, the Anishinaabeg, the Ojibwe, the Haudenosaunee, the Wendat, and is now home to many diverse First Nations, Inuit, and Métis. OMSSA appreciates and acknowledges that many people participating in our webinar today are joining us from communities across what has been deemed the province of Ontario, which is covered by 46 treaties and agreements. As members, and in particular board members and staff of OMSSA, we are committed to advancing equity, inclusion, and reconciliation through our work in human services. The work we have ahead of us is challenging, but our commitment and compassion will drive us forward. I'm grateful for the opportunity to work together. Miigwech. Thank you. So this year marks the 75th anniversary of OMSSA, and the association is pleased to offer a webinar presentation by John Stapleton of Open Policy Ontario and a panel discussion that will follow the presentation. There is a long history in Ontario providing funds and programs for people with disabilities and those who are unemployed. Such support would later expand to include people experiencing homelessness and families in need of quality early years and childcare. The history of social services in Ontario is marked by struggle and a complex relationship between the federal and provincial governments and municipalities connected to who can deliver these services. And all of this taking place against a backdrop of a changing political and economic condition, not to mention several life-changing events. This reflective webinar will provide insights into the early motivation for government social supports and how these programs have evolved and expanded over time, and as program and service delivery have changed, starting from the founding of Upper Canada to contemporary Ontario, and then OMSSA's role within this evolution. So at this time, I'd like to turn it over to John to begin his presentation. John, over to you.
Thanks very much, Rob and Teresa, and all the people in the background. And what we're going to do today is talk about the beginnings, really the colonial history. I have separate presentations on First Nations social services, but this is a separate piece. And so we'll go back to 1793 when Lord Simcoe came to establish the Muddy York and the what became the city of Toronto and Upper Canada. And we'll take that through the early years. This is going to be a bit of a roller coaster as I go through, and you'll have the impression that I'm at times speeding up and slowing down. That's actually purposeful because there's some places where I want to stop, pause, and really talk about some important events that went on, and other parts that are not that they're less important, but at the same time they don't impinge in the same way on municipal social services, which is what we're really here to talk about today, and the 75th of OMSSA. So you can see that the first part of this presentation takes us up to the birth of OMSSA, and then next slide, please. And then the part two, which will be shorter, will be the 1950s and 60s and up to the naming of OMSSA in 1972, which is also the same year that UNWA, Ontario Native Welfare Administrators Association, started, and also when the Department of Social and Family Services became the Ministry of Community and Social Services. All three turned out to be in the same year. So we want to pause there a little bit and talk about that. So let's start back to 1793 and next slide, please. Okay, so we're talking first about the very early years from 1793 up to the stock market crash in 1929 and the Great Depression. The lead up to World War II, which could also be called the 10 lost years of the Great Depression. Then we're going to go through the war years and the importance of them for what happened in the post-war reconstruction and the birth of OMSSA. And then, so we will have sort of the fluid beginnings, and then we will get to the very specific beginnings to the birth of OMSSA in 1950. And don't worry, later on there's a slide that says OMSSA started in 1951. Well, sort of the first big meeting after the foundation was in 1951. So, but we don't have to worry about that. 1950 was the first get together of the municipal administrators that started OMSSA. So we'll get into that. Next slide, please. So the Ontario government had a long history of providing funds and regulating programs for persons with disabilities and people who are unemployed. But the key to Ontario, and if we look at U.S. states, if we look at the provinces in Canada, Ontario was one of the only early jurisdictions that did not enact a poor law in 1793 when Upper Canada was founded. So the Elizabethan poor law was not brought in, and that what basically the Elizabethan poor laws had state involvement in poverty reduction and in caring for the poor and the vulnerable, but the view was of largely utopian view that coming to this new world that perhaps they wouldn't need these sorts of supports and services and that sort of thing because they would have a utopian society. So there was thinking along those lines. In 1793, the poor law was not brought in. And the importance of that, the key importance of that is that by default, all of the services and supports that were required developed at the municipal level in Upper Canada, in Ontario. That was not the case in various states, and it was not the case in other provinces where either they did not have the development in the first place, because it came into Canada at a later date, or that they actually enacted some part of the Elizabethan poor laws. So that's the important founding thing. Why are municipalities so involved in Ontario and not any place else? Goes right back to to that foundation. Next slide, please. So in the pre-union period going up to 1840, those 50 years, basically what the governments of Upper Canada wanted to do and tried to do was to regulate. They didn't want to run things. So they created these commissions, and they had asylums and houses of industry where people would go to work off their debts. They would call them jails, spelt as GAOL. And government believed private and public charities required regulation and control, but they wanted the private and public charities, just as today food banks don't take government subsidies. There's a sense in which that we would have the various public and private charities running the show, but government believed they need to be regulated. And again, no poor law. Government dispensed funds to charities, the six boards, and they were largely occupied with the issues of orphan children and people with disabilities. People didn't get, the average age of death was still in the 40s back then, so it was not that much issues with seniors. Next slide, please. So the period from 1841 through to 1867, when we had a clear delineation of Upper Canada and Lower Canada and governments, British governments, and in Upper and Lower Canada, and the French fact in Lower Canada, Ontario brought in its first what it called lunatic asylum. And you're going to hear me using a lot of anachronistic words, which are very pejorative right now, but at the time, that's what they were called. So interestingly enough, and also important, is that Upper Canada did not implement the British Poor Laws, nor did they recognize the 1834 reform of the Poor Laws that brought in large amount of government support and regulation in England. And remember that England was a unitary state. In other words, there was no provinces. They had only the local level and the national government. They did not subdivide populations in institutional settings, which they did under the British Poor Law. And also under the British Poor Law, of course, you had the idea of lesser eligibility. You had workhouses, and they were very, very specific and disciplined. And those institutions had very set rules. All of that didn't take place in Upper Canada at that time. So there was a chaotic development of institutions at the local level, few provincial standards, and again, the theme here is municipal default. If you have the province, and of course we didn't have a federal government at that time, what you had is the municipal level taking on all the administration of supports to the vulnerable. Next slide, please. So in that union period, also persons with disabilities could be placed in jails, lunatic asylums, houses of industry, what we call a house of refuge, which was the forerunner of the home for the aged, and with poor, aged, and others. So everybody's in the same places. If you're poor, if you're sick, if you're disabled, if you have developmental mental disabilities, neurodevelopmental neuroses, psychoses, everybody was basically in the same room. There was a widespread belief that persons with disabilities should be removed from society, especially if they could not work and the family was unable to care for them. And remember, we're at a time when people didn't know what disabilities could be caught by other people. So you often had people with cancer and people stayed away from them because they thought they could catch it. And you had instances, and it was not until we had successful anesthesia where we could basically open people up and put them back together, that we knew what was mental and we knew what was physical. And so there was real fear of people with disabilities, and that's why they stuck them off into these various asylums of sorts, because the idea that if you were near them, you could somehow catch what they had. And so there was little distinction between the jail and the poorhouse because we didn't have the British Elizabethan poor laws and the reform. Next slide, please. So distinctions were very vague. As I said, distinctions not made between disease, disability, but the Durham report that was influential in that period in the 1840s just simply regulated the counties must have a house of industry, a jail, an almshouse, a house of refuge, hospital, and asylum, and all of those had those gradations. But again, the government didn't do it. In 1848, the poorhouse established at Elm and Elizabeth Street in Toronto is now the headquarters of the YWCA, but that building, the facade on that building, is the old poorhouse of 1848. And so there's various different buildings, especially around the city of Toronto, and for those of you in other parts of Ontario, and you will know that there are those places that still either the facade or the buildings are still in place, and they morphed over the decades into various different other types of institutions. For example, the one at Elm and Elizabeth was a poorhouse, then it became a workhouse, then it became a house of refuge, then it became an old age home in the 40s and 50s, and became what was known as an EPC, which is an elderly persons center, and then finally was given over to the YWCA and basically bought it at a certain point. So that's how those buildings often have remained and then morphed over the years. Next slide, please. So now we have the Confederation period. Now we got a government of Canada. And in 1876, we had our first Ontario Asylum for Idiots, as it was called, open in Orillia. And we started getting these gradations at the local level between people. Now, these are old, anachronistic, highly pejorative names, but they had distinctions between people who were idiots, people who were imbeciles, people who were morons, and they had very they didn't really, in a modern sense, did not know what they were doing, and the pejorative aspect of this is very important. As I said, first, routinely reliable organ surgeries that followed the discovery and the invention of anesthesia. We had our first Charitable Institutions Act, and better segregation of types of people within institutional settings, and increased regulation. Now, in 1893, and here's where I want to stop for a second, Toronto hires its first relief officer. So the first worker was actually hired in Toronto social services worker in 1893, and it was inspired by the Goldwin Smith speech of 1889, an extremely important speech. Next slide, please. So this is what it would look like if you had it on your knees and listening to Goldwin Smith in 1889. You'd hear his 1889 to the speech to the Conference of Combined City Charities of Toronto, and he was the president of the conference. And next slide, please. And what I want to concentrate on this little slide screen grab is he's talking about the need to have a worker, like a government authorized, a government spending, really the assumption it would be at the municipal level. But just he talks about in the middle, I'll start where he says, just slightly up from halfway, to voluntary effort, and especially to that of the churches, we must look for the relief of the indigents, which shrinks from sight and would never ask for public relief, yet is often accompanied by the keenest suffering. Now, this next sentence is key. But though you may rely mainly on these agencies, you cannot in such a city as this. So think about urbanizations and the fact cities are getting larger and more complex. Rely entirely upon them. Responsibility in the last resort must rest somewhere, and it can scarcely be thrown even on the most devoted volunteers. Volunteers cannot give all their time, be always ready at a moment's notice, or be always in the city. Cases of emergency must occur, particularly in the depth of winter, and if no one is responsible for relief, the community may one day be awakened to the necessity of a change by something that would shock its humanity. Then he goes on to talk about the treatment of tramps and vagrants, which again, anachronistic language. But this was really the first real call for government involvement in social services, what we would call social services and supports and agencies. In other words, it would no longer be just charitable and volunteer. Next slide, please. So in that period, so we really think of 1893 as the first government involvement and municipal involvement in social welfare writ large. And we had the growth of outdoor relief. What does outdoor relief mean? It means just that you would help, or what they called relieve the poor outside of an institutional setting. So indoor relief was the idea that you put anybody who was poor or vulnerable or sick or disabled or orphan, you put them in a building and you put them off on their own. So the idea that you would actually help people while they're living in the wider society. So really interesting. And in 1914, Ontario got its first income security program, which was the workman's compensation, as it was called back then. They didn't have WSIB yet. And it was among the first money-based income security program where someone who had suffered a workplace injury would actually get dollars in their hands. And so that was quite novel. It was only a part of what went on in workers' compensation, but it was a first. And so we had the growth of institutions continued through the first half of the 20th century. There's various threads, both good and bad, that go through this eugenics movement, the whole idea of trying to create a master race and trying through selective breeding to actually minimize the amount of people who would be vulnerable by selective breeding. So we had all of that during that period. And of course, by the mid 40s, after the Second World War, that type of thinking was all completely died out. And we do have its modern versions of that, and I will go into that. Next slide, please. So War and Reconstruction, in 1915, just as World War I was really getting started, Ontario founded the Soldiers' Aid Commission. It still has its own legislation. It's still alive and working with veterans in Ontario. And whoever founded the Soldiers' Aid Commission was very smart to put it into legislation, because every time the government went to end the Soldiers' Aid Commission, they would have to actually end the legislation. And of course, it helped needy veterans, widows, and that sort of thing. And politically, that would be very tough to do. Now, important to note that in 1917, income tax came to Canada to support World War I. 1909, Churchill, when he was a conservative, and Lloyd George brought income taxes to Britain. 1913, Woodrow Wilson brought income taxes to the U.S. through a constitutional amendment. And by 1917, Canada could no longer hold out, although they tried to. Certainly, the prohibition movement, a lot of government taxation was done through taxes on consumable alcohol. And when you have prohibition, you're going to lose that taxation. The government had the end of the World War I to pay for and couldn't, and had to pay for conscription, and also had to look at catastrophic losses of revenue. So they brought in income taxes, and that changed everything because all of a sudden the feds had the money and the provinces under our Constitution had most of the responsibility. And so a new term was coined about 5 years later that you might recall or might know of, and it's called fiscal imbalance. And premiers today talk a lot about that. So the United Farmers of Ontario and the upheaval after the First World War came in on a promise of widow's pension, and the first mother's allowances came in 1920, which paid cash to widows. Now, of course, we had a lot of widows, and the reason we did, we had an influenza epidemic. We had munitions factory widows. The ordinance that we had back then blew up a lot. We had the suffragette movement. We had prohibition, and we had war widows' pensions. And people figured, well, it's unfair if we pay money to war widows, but we don't to other widows that might have occurred because of the blow-ups in the munitions factories. So there was a confluence of events that resulted in mother's allowance being introduced for widows deemed to be fit mothers. And the fit mother rule has seen all sorts of different incarnations of it in the man in the house or the spouse in the house and that sort of thing. And some of that lives with us today. Next slide, please. So War and Reconstruction in 1921, they added deserted mothers. You had to be deserted for 5 years and added that to mother's allowance. And four different eligibility criteria that you might find interesting is, first of all, you had to be a British subject and prove it. You had to have at least 2 children to get mother's allowance. You had to be a fit mother, according to the worker, the officer of the department, and you had to make an oath, swear an oath to the King of England, which was King George V at that time. Other interesting things in the 20s, we had the Ontario Society for Crippled Children was founded. And so again, these are agencies that got government funding and more government funding was flowing to agencies. And in 1927, we got the first blind person's allowance paid under the Old Age Pension Act, which also came in 1927. And this is really a following up on the old age pensions that were brought in Britain in 1910 under Churchill when he was a conservative, and Lloyd George, and the Bismarckian ideas in Germany of the beginnings of what we call the welfare state, or where government gets involved in the payment and the administration of social services. We also had the discovery of penicillin and antibiotics, so we had lots of and various different vaccines, which we're starting to we were starting to really get a handle on sickness and disability, what caused it, and what could be done about it. Next slide, please. So from 1928 to 31, well, that is the stock market crash and the move into the Great Depression. But the Ross Report of 1929, which was an inquiry into standards of children's institution, led to the creation of a moon ministry called departments at the time. Not till 72 did we call them ministries. And that became the Department of Public Welfare. And guess what? The social assistance or relief was not part of the new department. It was a regulatory department. But then there was a report, especially when we got to 1932, we had 25% unemployment. We had 15% of Ontario's population on something called relief, which later became welfare, which later became social assistance. And Campbell's report of 1932, he was the uh, the CEO, what would now be called CEO of the Ford Motor Company of Canada, and he and a top a bunch of businessmen, and yes, they were all men, without air conditioning in July of 1932, which was one of the hottest summers on record, hung around for Queen's Park for a month and said, "What can we do? We are really worried about a communist revolution coming to Canada. We're really worried about these men and vagrants and ne'er-do-wells riding the rails, calling at people's homes for food." And they thought, well, maybe the idea could be that we could do more for these largely men who were roaming the streets and riding the rails. And so there was a real worry that we needed to do something about that. And so the Great Depression really defied traditional views because people were saying, I just want to work. I can't work. I need to eat. I'm going hungry. That sort of thing. There was a real desperation there that really changed things. And this is really when the municipalities took over all of that relief. Next slide, please. And this is really one of the most important slides here. This is really what you're seeing a photo of Dr. Williams, Dr. Cliff Williams, who's probably one of three of the most important historians of social welfare in Ontario. The other two are Jim Struthers, who has late been involved with Trent University, who wrote The Limits of Affluence. And the third is Richard Splain, who wrote the early history that you just heard a lot about. Without Richard Splain, Dick Splain's book, I wouldn't have been able to do much of the early part of this presentation. And as Cliff said, and I want to read this, but it was the Great Depression that forced the municipalities into the forefront as a source of relief for large segments of the population. So this is everybody now. This is all parts of the population. A permanent change had been effected in that local governments had come to accept that at least some welfare services were their responsibility, and most had taken delivery into their own hands by then. The old system, where out-of-door relief, in other words, non-institutional relief, was farmed out by the city or town to a house of industry or some such private charity, was seen no more. And this is what Doc Williams, I took that photo of him and at a ministry get-together in 2005. He passed away in 2006, but a very, very important historian. And he was director of the General Welfare Assistance Program going back to the 50s and 60s. Next slide, please. So the lead up to World War II, a very important figure you're seeing there is David Kroll, because David Kroll was a minister under Mitch Hepburn, the Hepburn Liberal government, and he was 34 years old. He was born in 1900. He was 34 years old when he became minister. One of the first Jewish ministers, I think, in Ontario, if not the first. So he's a young guy. And he was responsible for bringing in cash relief to the municipalities, because a lot of the municipalities were going bankrupt and they could no longer hand out, bags of coal and clothing and food, which they used to do. They used to have these big, done like in bowling alleys and that sort of thing, and arenas where they would put together relief. We see these sorts of things after, floods and earthquakes and that sort of thing. But that was the way. They didn't have cash then. So he brought that in, and he also became Minister of Labor later on and brought in the first general minimum wage. So a pretty important guy. Later became a senator and did a poverty report in 1970. So he's important throughout his life. All municipalities continued to provide their system of vouchers, clothes, and food hampers, seeds, and bags of coal and coke for fuel. But at the same time, many could not. And the only thing they could really do is hand packets of cash out. And they did that. Next slide, please. So caseloads across Ontario moved towards 400,000 beneficiaries. If that doesn't sound like a lot, because it's higher now, this was at a time when Ontario's population stood at 3 million, not 16 million. So almost 16% of Ontario's population received direct relief in 35, while many others received the indirect relief where they would provide work in return. The municipal relief administrations were stretched, as Williams put it, beyond the breaking point. It was just in my talks with Dorothea Crittenden, who later became Deputy Minister of Ontario, and she was a young gal working in the relief department back then. She said you just couldn't believe it. You were there on nights and weekends, and you were just handing out food to people to keep literally to keep in many cases for them, as she put it, from starving to death. It was that bad in the early 30s. Next slide, please. But tensions were growing, and Hepburn was a famously mercurial figure. And he outlined his feelings about municipalities who asked for more cost sharing to pay for relief rolls. And I'll quote you this one. There's a growing impression among the taxpayers of this province that they are being drained of their money to provide a living for idlers. We will pay the municipalities a lump sum each month. Mackenzie King had basically said the same thing to all the provinces at that time. In other words, we will say to them, here's the alimony, you raise the children. Absolutely dripping with sarcasm and anti-women sentiment. I mean, it's just such a pungent quote. And if you're wondering the relationship between Hepburn and Kroll, well, Kroll simply basically fired him out of both departments because they didn't get along and didn't have the same sort of particular views of what government should do. Next slide, please. So again, this lead up to World War II in the 1935 to 39 period, all the municipalities were tinkering with what they called Campbell rates. So they took this. You can see the screen grab of the front of the book and his photo there. They were taking these rates in this 1932 document that were many people thought would never come in, the place that the government actually paid them. And now different municipalities were paying Campbell plus 5, 10, 15, 25, and in parts of Toronto it was 39 and became part of the common lexicon. Next slide, please. And so in 1938, Hepburn decided to have a social assistance rate cut. So for those of you who think that the 1995 Harris cuts were the only ones, they were not. The 1938 rate cut was a very strong one. But here you started really seeing the strength of the municipal voice here. So it wasn't just howls of derision, but the stronger voices came from municipalities that looked at the province's move more symbolic, clearly meddling in the municipal view where the province did not belong. Hey, we're running the show here. We're doing all this work. We're the ones out there actually paying the money out to people. We're getting very little from you. We certainly didn't get along with Hepburn. And the summer of 39, great plans were conceived to fight the government every turn. Next slide, please. But this one skirmish did not get a chance to play itself out because we went to war and World War II was starting. So next slide, please. So let's go through the war years here. Next slide, please. And so what we saw now is something that we call the irreducible minimum because Ontario's monthly average relief rolls dropped from 133,971. So we're already down from 400,000 down to 133,000. And then they dropped down to 1.9% of the population. And by the end of 1943, only 15,000 Ontarios were still on any form of relief. That's mother's allowance. The women were in the munitions factories. The men were overseas. The people who were back here, there was lots of employment for everybody because so many people were away doing other things, and we had very few people on assistance. Next slide, please. So various groups in Toronto during those war years, and especially as we started to realize that we were going to win the war and the boys were going to come back home, women and men, many deputed to the Public Welfare Committee that the Campbell rate should be scrapped in favor of rates that reflected proper scientific dietary standards. And the questions were relief rates sufficient? And if mothers could only cook and prepare food properly, would they have enough money to prepare nutritious meals based on what they receive? Next slide, please. But more important was the changing context of the war itself, because it heightened the consciousness of Canadians about questions of diet, nutrition, looking at the inadequate health of army recruits, of conscripts, the standards of support necessary for families of those fighting overseas. Remember, they'd lost their breadwinners, and maybe mom was out in the munitions factory, and of course they had ration books. They could only get certain forms of foodstuffs at the time, and also the raising of concerns about reconstructing society. Next slide, please. So 43 and 44 were some pretty busy years. First of all, we had the E.W. McHenry report on food and nutrition. He was at University of Toronto, and when he came up with the cost of those food baskets, it was much higher than was being paid on relief. We had the Marsh report on Social Security, which basically talked about all of income security and social assistance all coming to the federal level and being taken care of there. So not even the province or municipalities would be involved. We got unemployment insurance, of course, been in 1940. Baby bonus was 1944. The Department of National Health and Welfare was 1944. The Department of Veterans Affairs was 1944. And then a woman by the name of Charlotte Whitten, who went on to become the mayor of Ottawa, but had been a staff right at the beginning of the Ross Report in 1929 that created the Department of Public Welfare. She put out a very important report, which had a lot to do with the founding of OMSSA. And we had the first Toronto Guide to Family Budgeting published in 1944, and it went on for 43 years till 1987. Was often people advocated that the rate should follow those guides to family budgeting. Next slide, please. So the lead up to OMSSA, and let's get into the Reconstruction and the Great Debate. So the first was the Ontario government's decision to bring in a home for the aged in every county. But the second was the tug of war between two forms of thinking. The first was that services should be, and income support should be run by a cadre of centrally administered professional social workers free from the interference of all government, and the incumbent municipal structure that increased its hold on service delivery during the war and through the Great Depression. So you had this divide between this the way municipalities already done things and this new idea of professional social workers. Next slide, please. So the Great Debate occurred in 1947. So let's get on to that. Next slide, please. So here's Charlotte Whitten. She was part of the original administration of public welfare, and she wrote this report that recommended a complete overhaul of services, placing services in charge of the social workers in charge of the new system. Whitten had support from the new deputy and the new minister in the provincial department. Next slide, please. And Whitten's recommendations lined up with Leonard Marsh's report. Let's get all the income security, social services down, income maintenance up was the sort of the the catchphrase at the time. And the federal Dominion Green books that were written to get ready for the post-war era talked about the federal government would take over these programs, they'd run them, and they'd get some money from the provinces to do so. That's a photo of Leonard Marsh there in the screen grab. Next slide, please. So here we have, in 1946, the Dominion Provincial Conference was going to take all of the income maintenance, all of the different indemnity payments to individuals up to the federal level. It completely collapsed because Premier Duplessis of Quebec and Ontario's George Drew would accept, neither of them would accept a handover of taxing power without specific controls over the programs that Prime Minister King was not prepared to give up. They just gave up and walked away from the whole thing. So all of a sudden, you got the municipalities who had run the whole show from the early 30s through the war, and now we're going to give it all up. All of a sudden, they're being told at the end of 1946 that they got it all back again. Next slide, please. So here's this great debate with the federal government out of the game. The debate over centralization and professionalization took on a new life. All of a sudden, this was a live debate again. Powerful proponents of the local municipal delivery, let's deliver it the way we've always delivered it, the way we did throughout. And Goodfellow, the new Minister of Public Welfare, and Leslie Frost becomes the Premier. They're all on the side of the municipal delivery and against the Charlotte Whitton report. Next slide, please. So during that summer of 47, we had the Ontario Conference of Social Welfare, a major gathering. Everybody who was a player in all of this, whether it's workers, social workers, municipal representative, provincial, came to the table. Next slide, please. And Harry Cassidy said, local politicians talk about money all the time when they discuss welfare questions, appear to be oblivious to the issues of human well-being that are involved. And then on the other side was Grant Crawford. Next slide. Who said municipal councils have a healthy skepticism of all these experts and promises. They need to satisfy elected representatives with factual evidence that people will have their needs met. The primary responsibility of elected representatives is to those whom they represent. They don't have responsibility to the underprivileged or those in need of assistance. So the battle lines were drawn. Next slide, please. Enticed by 50% cost sharing. So the province 50% cost sharing for the municipalities to take it over. And Toronto, Hamilton, and Windsor formed welfare units in anticipation. But then the Progressive Conservative government, because they were still having this great debate, in the end, finally, in 1949, refused to proclaim it. Next slide, please. And here's really the birth of OMSSA, the lead up to it. Next slide, please. The three new self-proclaimed welfare unit administrations were fed up. They did not necessarily accept the deep divisions between left and right, academics and politicians, or certified professionals and administrators. The administrators thought the administration of social services and welfare needed to be separated from partisan politics at all levels. They did require some professional social workers. They saw the great post-war debate as opening up needless false lines that were counterproductive to moving forward. So while we're having this great debate, all these administrators are saying, look, we got to run this program. Will you guys please cut it out? We got work to do. Next page. Next slide. Thanks. So to these ends, a group of administrators, many of it actually attended the 47 conference, got down to business and talked about creating a professional association. And they were encouraged by the welfare director, Jimmy Band, who was deputy minister in effect for 19 years. And in 1950, 40 people attended the first annual conference of the Ontario Welfare Officers Association, which became OMSSA in 1972. So there you have it. That is the creation of OMSSA. And that's why it came down. It was the up through the middle and saying, look, we got to stop this debate. We got to talk about administering professional social services. And we need everybody as part of that. Next slide, please. So 75 years of OMSSA. Let's start with the 50s. And again, I might be a bit faster here because a lot of the things we're going to talk about in the next hour and debate are these issues. So OMSSA was created to represent municipal interests, best practices, advocate for improvements, and the focus areas were on welfare administration, public health, and housing. Also, of course, what was called at that time day nurseries, child care. The ministry at that time, or the department, had 22 pieces of legislation under its purview, and they had 22 directors, and that's how the government was organized at that time. Next slide, please. So here's some of the characters. Jimmy Band, who was deputy from 50 to 69, very much a friend of OMSSA and the welfare workers. And then here's just a sort of a trivial piece here where you have ministers together who were ministers in all three governments that have been represented in Ontario. Tony Silipo, who was Minister NDP 1993 to 95, Uremko from 67 to 71, and Sandra Pupatello, who was Minister in 2004 and 2005 for the Liberal government. Next slide, please. So some of the things relevant to OMSSA that in the history of social welfare, in 50 we had the forerunner of OMSSA formed. 51 we had divorced mothers, added the mother's allowance, blind persons, disabled persons, folk rehab were all started. Getting municipalities out of old age pensions, municipalities were allowed to top up, and that occurred throughout the 50s. But basically, the municipalities and the province got out of delivery of old age security. We had the Goodfellow Commission on Ontario Indians, led to Indian social services. Unwed mothers were added to mother's allowance in 56. We had the first post-war recession. And in 1958, we had the General Welfare Assistance Act, and it repealed the Unemployment Relief Act. And guess what happened there? For the first time in 1941, during the war, there was no eligibility for single relief recipients or single welfare recipients. And it wasn't until 1958 that eligibility for singles was added back into the General Welfare Act. Next slide, please. So let's look at the 60s and 72 and beyond. The introduction of major provincial programs, social assistance, GWA and FBA in the 60s, along with the Canada Assistance Plan from the feds that helped that, child welfare, homemakers and nurses services, all these different pieces of legislation were remade in the mid-60s in order to anticipate the Canada Assistance Plan that came in as cost sharing to the province and municipalities. And we had increased collaboration throughout that time. And then in 1972, OMSSA expanded its focus to include training and capacity building, became a hub for professional development and knowledge sharing. So 1972, the big name change that occurred, the ministry became the ministry from the department. ONWA was formed, the Native Welfare Administrators Association, and OMSSA. Next slide, please. So from OWA, I don't know how to pronounce it, Ontario Welfare Officers Association to OMSSA, municipalities 50 to 72 were the forerunner, and then to the present day. But by 72, there was a move afoot to get away from the word welfare, and also several of, especially the larger municipal offices, had developed and were providing services well beyond the administration of basic assistance. And social services have become more the accepted name, both at the Ontario government level and with First Nations and municipal social assistance. Next slide, please. So here's a fun picture of 35 years of deputy ministers of social services. You had Jimmy Band from 50 to 69, Miriam Borzak, who became the head of the Social Assistance Review Board, Dorothea Crittenden, who was the first female deputy minister in Ontario and perhaps in Canada, Bob Carman, and finally Deputy Bob McDonald. So that's a rare picture from famous Five Deputies picture. Next slide, please. This is a convention snapshot from the 1986 OMSSA convention. Don't worry that on the right-hand side it says that OMSSA was formed in 1951. In some ways, that's when the incorporation occurred, but the 1950 first meeting was really, in many ways, the founding, and it had the different. And if you go to the next page on the convention and just look at some of the topics, if you can read them, you had privatization of daycare, automatic enforcement of support, you had emergency planning, concurrent issues, programs and agreements for First Nations, for dental care. A lot of it sounds like today, perhaps with different words and organizing differently. Next slide, please. So 1988 to 92 became the period of reports in Ontario, and the Liberal government came out with a report called Transitions that had 700 pages, 274 recommendations, basically to completely reform. And again, that idea of things going to the federal level was part of that. And of course, we got coming out of that, the recommendations became the child benefit and the Ontario child benefit, the Canada disability benefit, which we now see. And so the follow-up reports that were done in the 90s called Back on Track and Time for Action under the NDP government talked about the implementation of that. But a lot of those things actually have come into place over the last 25 to 30 years from those earlier reports, and really in some ways mirror the mirror going to what we have today. Next slide, please. So an important thing we're going to talk about later is the downloading and the fact that so much of a responsibility is under the PC government from 1995 to 2003. And at that time, OMSSA became a critical advocate for municipalities. And basically, OMSSA help municipalities navigate those complexities, especially in the areas of housing, social assistance, and childcare. Next slide, please. Ontario Works. OMSSA worked closely with municipalities to implement Ontario Works, which is a very different. We had rate cut in 1995, and that really was sort of a singular event that really looked at the role of Ontario Works and the change in legislation on OW and ODSP that took place in 1998, along with the downloading. Next slide, please. So here we go to the last part here. In emergence, renewal, and change, OMSSA is increasingly focused on providing training, certification, professional development, opportunities for municipal staff in all areas, continues to advocate for adequate provincial funding for municipal social services. And of course, a lot of the downloading we still have with us. It was meant to be something that took place around the year 1999, 2000, but a lot of has become really permanent and difficult. Next slide, please. So OMSSA has been involved in policy development, fair and effective policies relating to the services that municipalities provide and coordinate, the coordination between different levels of government on the ground, and policy influence in making change to services. Next slide, please. Legacy and impact. Next slide, please. Played a vital role in shaping social services, fostering collaboration. Local governments can effectively support vulnerable populations, and how it does that, and especially with in the modern area. And its history reflects its commitment to professional innovation and advocacy in municipal social services. Next slide, please. Thank you very much. So, Rob, it's back over to you.
Thank you very much, John. This is a great overview, and I'm sure I know the audience will appreciate the background and how decisions were made and how things changed over the years and eras, especially as those life-changing events occurred. So thank you very much. What we'll do now is we'll take a break, and then we'll come back to our panel discussion. So if anyone has any questions from John's presentation, we can bring them forward to the panel. But we'll break until 12:10, And then, like I said, we'll come back to our panel discussion, and OMSSA's Executive Director, Aaron Stotch, will take over and moderate that panel discussion. For anyone who is looking to take a break or to step away from their computer, you can leave your browser on. However, if you accidentally close it, in your meeting invite, you'll see the link for today's webinar. You can always just click on the link again, and then you can come back on and view the panel after the break. So I'll let everyone go, but we'll see you back here at 12:10. Thanks, everyone.
Welcome back from break, everyone. I'm Aaron Stauch, the Executive Director from OMSSA, and I'm pleased to be here to moderate this panel this afternoon. John, first of all, thank you for that incredible presentation. I think as being a new Executive Director for OMSSA, being able to, early in my tenure, come in and get such a rich history lesson of the organization that I'm now leading is wonderful. And I just thank you. I think taking the history all the way back is a good reminder of the journey that we've been on as a sector. It's my pleasure to introduce our panelists today, and collectively, I couldn't even do the resumes here justice and the impact that they've had on the sector. And so it's really a pleasure to have this group here today. I have Douglas Bartholomew Sanders, a former OMSSA president in 2011 and 2012, and a consultant with the Beam Group. I have Catherine Chislett, consultant and senior advisor with Strategy Corp. Firm Dominelli, who's executive director of NOSDA. Martha Friendly, executive director of the Child Care Resource and Research Unit. And John Stapleton, of course, our esteemed presenter from earlier, is joining the panel. My challenge today is going to be containing the conversation to the time that we have available while our panel tries to instill a rich and deep sense of wisdom over their years and decades in the sector. And I'm looking forward to the challenge. Maybe starting with, and I will take a bit of an active role in moderating this and giving a chance to everyone giving everybody a chance to speak. So maybe starting with Douglas, and we'll go around the group. What themes stood out to you in this history, and how have things changed or not changed between then and now?
Thanks, Aaron. I think it's interesting to watch the cyclical nature. If you listen to John's presentation, there's a cyclical nature to the ebbs and flows in social assistance. We've gone from times where things have been very comfortable with social assistance to times where it's been very difficult. We've had provincial centralization. We've had municipal decentralization to the municipalities, to some kind of constant downloading that has mixed the two completely, so that we're never really sure who's responsible for what. But I think the one thing I want to draw attention to is the Melvin Smith quote that John read, which talks about if we don't, it essentially says if we don't pay attention to what's going on, we may end up in a place where the service system could offend humanity. And I think in some respects, we've gone through periods where it's done that, and we've reached it again, given that many of the services that we're responsible for do not collaborate, do not coordinate, and in fact fight against one another. And I think that's an interesting topic we'll get to as we move along today.
Thanks, Douglas. Catherine, maybe I'll turn it over to you here. Oh, Catherine, you're on mute.
Of course, after how many years of doing this, you still get the unmute. I thought it was a great presentation. What really struck me was the time that I've spent at council listening to councils talk about how they don't want to pay for social services, that they shouldn't have to pay for it. It shouldn't be on the income, on the property tax space. And, in fairness, there's a fair story there. It's quite good. But what I saw from John's presentation, the fact that municipalities have been players in this field for decades, that they have funded this for decades. It's definitely and squarely in the middle of municipalities. And often they talk about how we're here for hard services, for roads, for buildings and stuff. And as a commissioner, I come forward and try to talk about these social services and roles, and you often felt discounted. But in fact, there's this long, rich history. And it is surprising to me that it still continues to be an area of debate.
That is a fair observation. I was taken back by some of that history. I didn't realize it until John's presentation. So it's a good reminder. Fern, maybe I'll turn it over to you.
So I just want to pick up on some of the stuff Douglas mentioned about the cyclical nature, because I think that's so true over the years. And one of the things that I found going through the system is that, we always talked about that welfare wall that we locked people behind so they couldn't be successful. And what I think has changed is the welfare wall is still there, although with childcare, we have made a change there. So that's sort of gone in that sense. Housing is still there. But I think what we've also built now is a health wall, because our clients are so multi-barriered that in order for them to succeed to the employment stage, they've got to get past some health barriers. And particularly in the North, where, family doctors and physicians many people don't have them, or they're far away. I find that sort of health wall is another struggle for our clients to actually climb over. So it was sort of like a double barrier we put in front of them. And I think that's one of the challenges that I think we see that with our homeless in the streets every day, and people who are living on the streets. So I think that's one area that seems to be new, but maybe it's not. Maybe John will better than, but it seems to me that looks different right now.
Martha, I have a slightly more specific question for you than just on the general themes, which is, can you talk a little bit about how 50 years ago the child fee subsidy was a type of residual welfare support, and how that has changed since then? I think we were already alluding to it in the precursor to this with the release of Ontario's Auditor General report today, and I would love for your thoughts and reflections on that.
Yeah, I have many, but fitting them into this, I should just say who I am, because I'm the non-social services administrator in this group. I've been a researcher in childcare for 50 years. I first came to childcare research working at the Social Planning Council as a childcare researcher. It was my first job after immigrating to Canada in 1971. But also important, I was a parent at the York University Cooperative Childcare Center at that time, and it was a real breeding ground for activism, which fed into the childcare advocacy movement as it now exists. So that's kind of my frame in this whole thing. When I first came into this, and it's not anywhere near where John goes back to, or even as long as World War II, but at the time I came into it, the 1970s, the sole government childcare funding was in the form of subsidies for low-income families under the Canada Assistance Plan. From my perspective, these came through what we called Metro Toronto before amalgamation, and this was the main advocacy focus until the 1980s. It was local. And consistent with the funding that came through the National Welfare Program was the view that daycare was a welfare service for those in need. And CAP and Metro defined it that way from a legal point of view. At that time, subsidized parents were actually needs tested in Ontario, and this existed, I think, until at least the 1980s, or even later. It was needs testing rather than income testing for a subsidy. And there was also that time, I think is important, there was a suspicion that daycare probably wasn't very good for children compared to mother's care. This prevailing view really shaped the way municipalities treated childcare at the time. But of course, there was a counter view, which was put forward by us uppity second wave feminists, that quality childcare should be funded and provided for everyone, and that it was probably beneficial for children as well. And that was the perspective that I came from. If you remember, at that time, only a minority of mothers of preschool age children were in the labor force. It wasn't until at least the mid 1980s, about 1986, that these began to represent even a majority of the mothers of children. So I have to skip ahead 50 years of fascinating childcare history, downloading and so forth and so on, to the present day. what has really changed is the prevailing view of childcare, and this is true across the social and political spectrum. It has really evolved to the idea that quality childcare should be funded and provided to everyone, that it's a children's right, it's a women's right, and that it is a pillar of the economy. And this kind of circles back to it being an employment, a support to employment for low-income mothers, but now it's a broader pillar of the economy. And over the years, this view did grow incrementally in Canada, but it's quite clear that it was probably the pandemic that pushed Canada over the brink into accepting the idea of a modern early learning and childcare system the way it has long existed in some other countries. So today we have CWELC, the $10 a day plan, which promises quality, affordable childcare for all. And it's in the process, as you know, of evolving Canada-wide. Based on this significant change, I want to make two observations that I really only came to in thinking about this panel. They're directly pertinent to the history and role of Ontario municipalities in childcare. So the first one is this. Paradoxically, licensed childcare in Ontario, and this is true now in every province and territory except Quebec, has moved into ministries of education. That began Saskatchewan was the first province actually moved to education in 2005. In some jurisdictions, it's even been renamed the Ministry of Education and Childcare, or Early Years, some variation of that. But interestingly, Ontario mandates childcare as the responsibility of municipal social service system managers, along with other social and welfare services. Certainly the childcare roles of the social services managers go way beyond that now. They've really built up with the new view of childcare. But some elements of the old welfare mindset do still continue, like the fee subsidy system, whose processes are still unchanged. I'm not suggesting a solution. I'm just making an observation about this, which is actually quite interesting when you think about where we've come to. My second observation has to do with the idea that from the 1970s that the orientation of childcare was for low-income families, in contrast to today's commitment to a much more universal approach. Interestingly, though, as we know, and we've seen in the Auditor General's report released today, low-income or vulnerable families are much more left out of the childcare system. Newcomers, families in low-income neighborhoods, precarious workers, Indigenous families, what we haven't seen happen, and this would be in Ontario and Canada-wide, is that there's insufficient policy that's been put in place that even addresses the issue of equity at a high level. The targets are kind of global targets and that sort of thing. And there are a number of reasons why that's happening. Ironically, it's the same advocates like myself who once insisted that childcare should not only be a targeted welfare service, who are now pointing out that the CWELC process needs much more equity goals, with much more public management of how equity is being managed in terms of access to childcare. So I'll just end there, trying to reflect on these enormous changes and challenges in childcare, which I think the municipalities in Ontario and OMSSA are really well positioned to address.
Martha, thank you for adding that additional context on the childcare. Before we kind of move on to the next set of questions, maybe we'll turn to John and say, based on the comments from Douglas, Catherine, Fern, and Martha in your presentation, is there anything that stood out to you from this conversation so far?
I guess what's really stood out in some areas, as Martha noted, and Fern and Catherine and Douglas, is that some things change and other things never seem to change. And I could take the example of the downloading that occurred under the local services realignment that started in 1998 under Mike Harris. And I recall thinking at the time, and in maybe the 4 or 5 years after, was, okay, so this has all taken place and it's all we have all the realignment in place. Now we're going to start to see the reforms that will come out of that. And I'll give you the example, just one example, and that is of rental rates in subsidized housing. The single rental amount for an OW recipient in subsidized housing in 1990 was $85. It was $85 a month in 1998. Guess what it is in 2025? It's $85 a month. I mean, these things, you cannot run a housing portfolio at the municipal level getting rents of $85 or $139 for an ODSP recipient. So all the stuff that just absolutely had to change in the early 2000s has not. We still have OW rates of $733 a month, which are lower in real terms than what Mr. Harris cut them to in 1995. So you have this whole array of things, especially in the social assistance and the housing rent area, that have not changed at all, and yet we've seen huge change. Like the Canada Child Benefit came in, the things you talked about, Martha, in terms of childcare and housing, under different ministries and seen differently. Catherine, what you said, and Fern, in terms of some of the perhaps the negative changes in health. But I mean, here, this whole hierarchy of deservedness and all this business of welfare benefits, it just seems to be impervious to reform. Basic incomes, guarantees, all sorts of great ideas aside, it just seems to be impervious to reform. And I think that's one of the real conundrums of social services in our time.
John, I think such a poignant statement. There's a piece of that I'm going to come back to in a couple of minutes, but maybe you hit the perfect transition into the downloading of the 90s. I think in my moderating notes here, it says the downloading of talking about downloading in the context of the last 25 years. I think we're beyond 25 years now. But Catherine, maybe I can turn to you to talk a little bit about the impact of that downloading on municipal social services and social services generally as part of this kind of next phase of the discussion.
Sure thing. I mean, it was a really cool period of history, I have to tell you. I was working for the province at the time, and the announcements just came out under the Mike Harris government. And I think it's really important to understand downloading was not a policy decision. It was never intended to be a decision to help serve people better or to improve our programs. It was simply for the provincial government to balance the books. And they had a lot of talk about that, a lot of language that may re-traumatize the folks around the table here, so I won't get into it. But that's all it was. And one day, we're pulled into an office, and worked with the Ministry of Housing at the time. We're pulled in and we're told all these these services are now being downloaded to municipalities. But housing isn't. The next day, we were called in and say, hey, guess what? They looked at the books again and they need more money. So housing is going to be downloaded after all, and we're going to work you like dogs for a year, and then you're all going to be out of work. So that's really how it launched. So it's not a surprise that it was very, very messy, very contentious at the start. I was on a billings team, and we would send bills to municipalities, millions of dollars they had to pay every month, without any information at all about what they were paying for. So it didn't get off to a good start with municipal governments and with their councils. They saw it as really not being transparent or not fair. But nonetheless, I think the impact has been positive. It's not been easy, but I believe it's been positive. Municipal governments were the closest to the folks out there, the level of service. We can understand the needs. We can work with our local organizations to deliver on those needs. We can integrate services, things that provincial governments just can't do because it's got to be the same for everybody. Now, that's not to say it's been an easy ride, because there's still so many barriers, even after 25 years. We have different municipalities having their different programs. We have, different reports. Oh my goodness, the reports that we have to do, different definitions of what homelessness means, what affordability means, privacy legislation that doesn't allow us to integrate the changing governments, changing amounts of fundings, all of these things play out. But I think it's really helpful, I think, for your audience to understand from municipal governments, there's this built-in and never leaving distrust that the province is always trying to pull one over for them. And I think it really has to do with the way that the downloading occurred in the first place and how, the changes afterwards just keep building on it. They never did have, safer pay, and that was a very serious concern at the time. But overall, I think it's positive for the people we serve. And if they take the handcuffs off a little bit more, we could do even better.
Thanks, Catherine. I see Douglas flagging for me, and this is the best part this is the positive about moderating this panel is I don't always have to come up with the questions. Douglas is flagging for me that he wants to add something on the downloading topic. So Douglas, I'll give it to you. Douglas, you're on mute.
Catherine did a great job of talking about the excitement of the downloading and having been there to do downloading of the family benefits and voc rehab to ODSP from the province to the city of Toronto. I remember those days well. The one thing that we always have to remember is that downloading isn't wholly or solely the exercise of the province saying, here's a program and here's the money that goes with it. You have to look for the subtle things that cause an impact on downloading that raises the cost of doing business for municipalities. For instance, when the program was downloaded, there was, we got the province's 50% of, or I guess it was 80 initially, but 50% of the operating costs that went for salaries and operations and all of those things. Unfortunately, in the download, there was never any allowance for a cost of living increase. So while it was downloaded to us by 50%, that 50% increases every year that municipalities have to give staff raises based on a negotiated settlement with a union. So we have no control over the salary or limited control over the salary. We have no control over the amount of money coming to us from the province. And that's where the property tax gets hit hard by having to augment what is essentially a provincial program and gives rise to what Catherine was talking about earlier, which is municipal councillors saying, we don't want to do this. This is the province's program. Let them pay for it. But ultimately, they keep paying more and more. The other side load that happens is the province has total control over the rules. So for those of you who remember back in, I think it was around 2012, that CSUM disappeared, and there was another benefit that disappeared, and they were both funded to municipalities based on the 80-20 percentages. As long as the municipality paid 20 cents on the dollar, the provincial government would give us 80 cents on the dollar. So there were some municipalities who were conservative in their spending, and then there were municipalities that were not conservative. And I think Ottawa and Waterloo region were the real outliers, where I went from Halton, where we were conservative, to Waterloo at the time. I went from Halton, where when they made the change in the funding to $10 per household per month times the combined caseload of OW and ODSP, I went from an enormous increase in funding because we hadn't been spending that much in Halton to Waterloo, where they had spent exponentially, and I inherited a $10 million deficit. So those are the things that you don't think about in terms of the impact on the municipalities that the municipalities didn't ask for and have no control over, but yet are expected to fix. So downloading, as Catherine says, it has its benefits. I think having municipal government deal directly with the citizens in its jurisdiction is perfect. It works well. The problem is it's not appropriately funded, and you can never get that funding to come out to a 50-50 split, which is the intention.
Thanks, Douglas. Fern, I'll turn it to you, and I'm just going to be a little cautious of time here in terms of there's a couple of things that I want to get to. I also want to flag that if the audience has any questions they want me to ask, start putting them in the Q&A section in the event, and I will ask them if I get an opportunity to. So Fern, I'll give it to you.
Yeah, I just wanted to mention from a northern perspective, the downloading is significantly different because in the north we have 144 municipalities. There's 444 in the province. Of the 144, 72 have populations of less than 1,000 people. So you can imagine, you've got 10 DSABs who are administering services for 143 municipalities, who 72 of them have populations less than 1,000. That's a real burden on these very small communities. And you're starting to see this up in, I can't remember the name of the township, but there's a couple that are actually near bankruptcy. And you're starting to actually see that. And again, it's not because we can't deliver the services, it's just the funding's not in the right place. Just to be clear. Thanks.
Great point, Fern. And Martha, maybe I'll just give it to you for a second to add in.
Okay, I just wanted to point this out that starting from where Catherine talked about this having been a financial, not sort of rational policy decision. I mean, you can call it downloading is one thing. Having appropriate roles and responsibilities for local governments is another thing, which would, kind of be rational. I mean, in my experience as an outsider, the way I see it is that the municipalities have been handed a lot of responsibilities, and many of the levers are missing. So they don't have taxation, the same taxation power. It's property taxes and all that sort of thing. And some of it is actually quite capricious in the area of childcare. So I just want to point out that a lot of it does stem from how municipalities fit in and how they're treated under these kind of like constitutional arrangements is actually a problem in actually delivering responsive services from my perspective across Ontario, even though a local role is extremely instrumental and could be extremely instrumental in making it happen better, and often is. Depends on how it's done.
Absolutely. Thanks, Martha. So the whole conversation so far, and this is where I drive everybody nuts because I go off script, so everybody starts to freak out a little bit. But there's a piece here that I want to weave some things that I've been thinking about lately together, which is so there's a few things that are happening contemporarily right now that really beg a reflection on some of this downloading history. And so maybe I'll just give a little bit of a preamble and a lead into, and then I'll start to gain some reaction to it. So first of all of this has happened in Ontario under a number of different premiers, starting with Harris, then Eves, then McGuinty, then Wynne, now Ford, right? Nobody has undone this. It continues to evolve. The rates stay the same in social assistance. Some of the other issues stay the same. And it seems to be regardless of party. At the same time, the impetus around the downloading could arguably be said to have been tied to what we were seeing as approaching the debt wall back in the 90s, where GDP, the GDP to debt ratio was reaching, and I'm not even going to try to cite the levels, but we're starting to reach unacceptable amounts. Over the last week, we have seen the parliamentary budget officer federally talk about debt to GDP ratios approaching those levels again. And we are starting to see trade disruptions and economic disruptions that are happening. So I think some of the utility in talking about this history is, what does that mean for us going forward? And in an economic context that may be starting to parallel some of the things that we saw that led to downloading in the 90s, I would be curious about what the panel thinks the current situation might mean for the future of the municipal role in social services going forward. And I see Douglas smiling, so I'm going to start with Douglas, and then I'll circle around with the group a little bit.
Interesting question. If you look at the municipal role in social services, it's already begun to shift. If you look at social assistance in particular, there was, until very recently, the municipal role in Ontario Works included employment. And if you look at the Act itself, the Act begins with Ontario Works is an employment program, not a funding program, not a cash program for recipients, but an employment program. And so for a number of years, from say 99 roughly until when did it shift? About 3 years? No, about 4 years ago, we maintained that responsibility, and suddenly the government of the day, the provincial government said, there's no return on investment on employment. We're not getting enough people off to employment and reducing the rolls. So they took the employment and put it out with MTCU, who then transferred it out to the to nonprofit organizations. Nothing wrong with that. I mean, in real terms, there's nothing wrong with splitting out the roles. However, what it did do, it then went on to centralize intake, which has diminished the role that the municipality has. They don't control the intake anymore. And as I've done reviews of municipalities' operations, what we find is that a lot of the intakes are either flawed, granted inadequately, granted inappropriately, granted when they shouldn't have been granted, which means there has to be a lot of rework done by the municipality that it's not responsible for. The province is responsible for that. Then if you take the other end away, which is employment, the question then becomes, what is the role of the municipality? Yes, it's there to provide caseload supports to clients, but the actual role of the municipality is now so nebulous that it's very difficult to be able to define it. And the question then becomes, is there an opportunity? Is there any potential later for the province to just take the municipality out altogether and operate intake itself and give all of the case management and employment to not-for-profit providers? Or do we continue with the municipality in the middle, not really understanding what its role is and not really getting any supports for this changed role? So I'll just leave it at that.
That's great, Douglas. Fern, maybe I'll turn it to you.
Yeah, I just want to pick up on what Douglas was saying. I think that what we're hearing is that the province sees too many case managers out there, too many path and navigators as opposed to people actually doing the work. It seems like, mental health has navigators, has case managers. Hospitals have case managers. Everyone out there has case managers and navigators. And I think that's what's causing some of this angst. And I think that's really important that we figure that part out as to what's the municipal role in this, because like Douglas says, in theory, that should be gone. I'm not sure what that would look like, but I mean, that's something we need to understand. And I think the key comes back to integration, which the province has basically set aside right now. And I think the real success story for municipal delivery is the integration that we provide at a local level that nobody else has the capacity or has even tried to develop, to integrate.
Great. Catherine?
Yeah, I really want to build on that. I'd like to think there's a lot of opportunities here, but I guess I'll be sort of a critical optimist on this. There's a real opportunity here to have an honest conversation about what needs to be done instead of just layering on. I mean, I always react badly when I see that we try to fix things through governance or organizational changes rather than getting at the root of the issue. And the root of the issue is people need help. And when we have to have all, as Fern points out, we have to have all these navigators, that tells you that the programs are flawed if people can't actually figure them out without other people to help. And in my role at York is a unique role because I had both health and social services. And it was astonishing to me the difference between the different areas, and yet it all comes under the social determinants of health. Income's the most important. We've all heard with a guaranteed income what a massive change it would make. If people could afford to buy the things they need in life, we wouldn't need all these other programs in place. How that plays out. So as long as income continues to be a problem, as John points out, it's still too low. Interestingly, income supports is not downloaded to us as service managers, so we really have very little say in it, and yet it is critical to how all these other programs offer. And then when we have all the barriers and the lack of decision making, I mean, we're on the social services side, but on the public health side, for example, when the dental program was downloaded, public health units were told they had to set up dental operatories, which are incredibly expensive. They had to know how to hire dentists. There's all sorts of dentists working out there they could have purchased a service from, but because there was a belief that this was the best way to do it without discussion with us, this is what was forced, which was really expensive and provided a poorer level of service. So we have examples of that. We could be here all day talking about that, but wouldn't it be amazing if finally we have the push we need to actually talk about what needs to be done in a very practical, focused way to actually do what we're here for, and that's to help people have better lives and reach the potential that they want.
Great, Catherine. Martha, I actually have a bit of a different question for you. And then, John, I want to kind of get your reflections on the history of the original question and then bringing it together. So, kind of going back to my preamble, Martha, in terms of some of that history and some of those parallels between the 90s and now that we're seeing, and particularly since we know that the Prime Minister has put out a call to the federal civil service for cuts over the next 3 years to fund it, to the spending that's happening. If you had a crystal ball, what are you thinking that means within the childcare and CWELC regimes?
Oh, it's not only me looking at the crystal ball, it's everybody in the childcare community. I guess the thinking is that there is a commitment to continuing what's already been committed to. I mean, there is, they've already made agreements with most of the provinces and territories, which is basically a 3% escalator on what was already there. But that really was never intended to be enough to actually, do the whole program. And, you have to go back to, so, I mean, our assessment is that, yes, there is. The question really is going to be, is there more money going to be forthcoming? There was never enough capital money, or that wasn't really considered adequately at the beginning. And the actual cost of continuing to expand at affordable fees with decent wages so that you can get expansion, that is going to take, that is really what the question is like, what is the commitment? So I think it's kind of a bit of a solve. I don't think that people are expecting that there's going to be a cut to what's already been committed. But I do think the question is going to arise about we're now in phase 2 of this program, basically. We did the foundation and people kind of got their feet wet in trying to develop the right provincial funding programs and, hopefully trying to tweak them. But the fact is that childcare needs to be provided as a program because parents can't reproduce it themselves. It is education in that sense. It needs to be a thing. And it costs money. And we know this from OECD work, from lots of other work. It's an expensive program. So even with the massive historic input that Canada has made, then you have the question, are provinces continuing to pay their share or upping their share is another important question that isn't raised enough because it's not a cost sharing program. But that really factors into it. So I don't have a crystal ball, but it really does hang on what's next, what's next. Like the commitment to the program is a program to be built out over a long period of time. We haven't finished the program. We only started the program. Anybody knows that. And in order to finish the program, to continue building it, we need more money from both levels of government, I would argue, not from the local level of government. And we need more policy to make sure that the money is being used well. And I do think that there are lots of places where one can examine it. And I'm not talking about austerity. Like how do you really make this program work? And we have, here I would say, that we have lots of examples from other countries. Countries that have good childcare systems spend more of GDP than we do. And I do realize we're entering this very difficult economic period, but childcare is a pillar of the economy. Canada can't work without it. That's my crystal ball.
Great. Thank you.
Both things.
Thank you. John, so maybe I'll turn it to you to reflect on the conversation that has ensued since my original question, and also your reflections on the parallels between the conditions that existed in the 90s when downloading happened and what we're seeing right now in terms of the economy and what that might mean for the future of the sector in OMSSA.
Yeah, thanks. I'd really like to weigh in on that. I think a couple of important things. One is the municipalities being taken out of funding of OW, like the move the province made between 2013 to 2018 to gradually bring that share to zero, has meant, like, if you use a corporate analogy, OMSSA, or not OMSSA, but municipalities always had a seat on the board, during the period when they were providing some of the money, and really. They were off the board by 2019. And I think the province says, look, if we're funding the whole show here in terms of allowances, then we'll do what we want. And we've seen what's happened as a result of that. We've seen it with ODSP referrals. We've seen it with rates. We've seen it certainly with the SSM process and delivery. But one thing I would say is that in 2002, 18% of people who were on OW were working. By 2024, 8.2% were working. And you take the municipalities out, and then you see what happens when you have this workforce development and the incentives and the rate structure we now have. People who are missing meals and who are worried about being homeless, that's not necessarily the best job readiness program. And I think we're seeing that. The other comment I have is if you go back to the 30s, we had structural unemployment of 25%, and we had long-term unemployment that took relief roles at that time up to 16% of the population. We had many recessions after that in the 80s and the 70s. We had the stagflation. But in the 1990s was the only time where social assistance caseloads went up. They went up to 13.9% of the population when the median, the long-term average is about 5 to 6. Right now it's 6.1. ODSP, men, women, and children, OW, men, women, and children make up 6.1% of the population. With large-scale structural employment, and long-term unemployment, if that is part of our future, you will see, and especially with the end of entry-level jobs with AI and things like that, you will see structural employment, which will impinge on caseloads in a way that could begin to mirror what we saw in the 30s and 90s, because the conditions for that would be in place. Let's not make the same mistakes. Let's not think about people in a different way, that all of a sudden people who were just fine and down on their luck are all of a sudden lazy. And, we need to stay away from that sense that allowed. I mean, Mr. Harris was. It wasn't a fluke. People in the early to mid 90s were really thinking, the workfare. We need to get people back. A real sort of beating up on the poor and a beating up on social assistance recipients. And so if we are facing those economic conditions again because of what's happening in the States and free trade and what's going to happen to our GDP, et cetera, and then we really can if we are mindful about it, the dented tuna, we can we can really start thinking about looking at it in a different way and protect ourselves in some ways from that sorts of stigma and prejudice.
Thank you, John. So anybody who has seen me moderate lately knows that as we approach time, I have one final quick question, and I ask everyone to keep it quick as we do this, which is to say, the work that we do is challenging work, and sometimes it's easy to lose hope and optimism in the space that we're in. But I think there's lots to focus on. I think I'd ask each of our panelists to share a quick reflection on what the history of OMSSA and where we currently stand gives you hope for the future as we continue on this journey and this important work. And I'll start with Douglas and work the way around the panel.
Thanks, Aaron. I think first and foremost, and I would be remiss if I didn't say this as a past president, is that OMSSA, more than 15 years ago, introduced the concept of integration of services. I think the future success of the multiplicity of services that municipalities offer rests in integration and taking a policy stand with the province about how that integration has to happen from the province down across funding envelopes. Right now, they keep us separate. Right now, they represent barriers. And the more we can integrate the services, the more we are likely to find some savings that can be reinvested into those services rather than let go to the bottom line. And the last thing I want to say is the future of the human services in Ontario rests with the hundreds, if not thousands, of staff who work in the municipalities and at the province who give their heart and soul. They truly care about clients, and they will continue to give their heart and soul. The one thing I miss about not being with municipalities anymore is those chats with staff and their really cool ideas about how we can make the future look brighter. So let's not forget the staff and how important they are to the equation.
Thank you, Douglas. Fern.
I guess when I pick up on Douglas's comments, I think that integration is really important. And I also look at the service managers as kind of the community planners, the same way we brought the child care providers together. But the one thing that I don't want us to forget is now for the first time, we actually have municipal politicians who care about social services. Before we went to AIM, it was all about roads and sewers and bridges. They're actually talking about social services. So I think we have a unique opportunity right now with the power of the municipal politician to make some positive change. And I think we need to show them the way.
Great. Thank you, Fern. Catherine.
Thank you. I 100% agree with Douglas and Fern. Integration is absolutely the way forward. And I'll say it has to extend even beyond social services to include integrating paramedic services, community paramedicine. Huge area of opportunity. Got to include public health. They seem to sometimes be working this way when we should be working together. There's huge opportunities here to do that. I think the future of OMSSA as well, we really have to get back to a place where we are the strong voices influencing policy. As John said before, that role of influencing policy. What I've been seeing, and I know Douglas and Fern have seen over the past few years, is there's just not those tables anymore, just not that influence. And we really have to fight and have that. We have the staff have the wisdom and the caring, and they have the information to provide. After all, we deliver the services. Provincial staff do not. They need our help. You know, they want to do a great job too, and we know what's going on in the field. So if there's anything we can do, that it doesn't matter who the deputy is, it doesn't matter who the provincial government is, that they understand that we are partners in this and we need to be working together on this.
Great. Thank you, Catherine. Martha.
Yeah, that's a really interesting question. I mean, from my point of view, I was just thinking about Ontario is unique in its role, municipal role. So there are two roles for municipalities in Ontario in childcare specifically. So this really does have something to do with integration. First of all, municipalities are the service deliverers, the local service managers, which no other province has even considered, actually. Which I think is, in my research, this is a function that is common in well-developed childcare systems. There's a lot of the work is done at the local level, and I think it's a really important role. And I do think that really could be brought out by OMSSA in a way that it hasn't been. That it really hasn't been written about very much. The second thing I think is actually it's kind of problematic actually, that the service delivery, service provision role, the direct delivery of childcare services was a very important municipal role in Ontario, and it's shrunk away to nothing. And there's a lot of water under the bridge about why that happened with provincial changes in funding and so forth. But the decisions were local decisions about that. As far as I can tell now, British Columbia has more municipally run childcare than Ontario does. And I think this is really interesting to think about that as a municipal role. And I'd love to see OMSSA discuss these roles specifically, because there is no well-developed childcare system in the world that does not have a large municipally delivered contingent, that it's primarily or heavily municipally delivered childcare. But it's really shrunk away in Ontario. So I'd love to see OMSSA take a leading role in actually exploring these two important roles in the way childcare develops, because I think it really has something to say that is kind of unique in Canada. So that's where I could see OMSSA really playing a convening role in actually foregrounding what Ontario has done, to some extent what the history is and what it could be.
Great. Unfortunately, John, I'm not going to be able to get to you. We're at 1 o'clock right on the dot, and I've got to wrap up the piece. So I want to thank the panelists, John, Douglas, Martha, Fern, Catherine. Your insights have been fantastic. And I thank you for sharing with us your expertise and ideas and thoughts as we worked through our conversation today. John, thank you very much for the presentation this morning, which was excellent and in depth and really informative. So everybody have a great day. There will be a survey shared out for you to provide your feedback on this event. And thank you for joining us and learning about the history of OMSSA and the social services sector in Ontario. So thank you very much.